Hi, everybody.
Finally back
Yes,
on.
welcome back. Summertime is busy with the kiddos and summer camp and vacations and all that stuff, but we are back and we are here to talk about one of our favorite treatments, but sometimes it gets a little bit of bad press, and that's filler.
Facial filler. What do we use them for? Volume restoration.
Mm-hmm.
We use it for minimizing lines and wrinkles. What areas can we inject them?
Yeah, so areas that are most common is our mid-face. So right around the cheekbone here, we actually lose a lot of volume as we age. You can notice that you've lost the volume in your mid-face if you start to see these lines or nasolabials. Your marionettes, these ones right next to your mouth. And also the under eye hollowing is another sign of some mid-face volume loss.
Yeah, and volume loss as you age is completely normal. I mean, it's part of the aging process. Some patients, it can be more dramatic based on a couple different factors. Really, genetics plays a big role. So if you look at your mom or your dad in their pictures, it's a high likelihood that one of those issues, one of the areas that they're suffering from some volume loss, you will have it as well. Activity, the more active you are, our runners, they tend to lose more facial volume loss. Sudden weight changes. I mean, we have a lot of patients that have been doing amazing with weight loss medications or just diet lifestyle changes, and they've lost weight. And so, really, when you had more fat in your face, it's going to keep it looking more plump. And when you start to lose it,
Mm-hmm.
it has nothing to hold it. So the skin starts to fall. You start to see the folds. And that's what people get bothered by.
Yeah, because not only are you losing the volume, but you're also losing that skin elasticity
elasticity
too. So the skin is not snapping back as quick. So that's falling as well.
And I think oftentimes when patients come in and they're bothered by something, even though it might have been a concern in the past, it was like a side angle picture at like an event or a wedding. And they looked at it and they're like, oh my gosh,
Uh-huh.
I didn't know it was, and so we do look at ourselves straight on all the time. But especially when you come in for consultations, I mean, when we're taking our pictures, that's part of the program is to like make sure we're rotating you
Mm-hmm.
because really no one really assesses themselves from the side. I mean, I'm already starting to notice it on myself.
Mm-hmm.
I'm going to have probably Rachel, Jess, or Christine. One of them are going to inject myself. I'll try not to be a baby about it, but let's touch on that. I mean, is it painful?
It's really not. So, we numb you, right? We numb you with a topical numbing, and then we also use ice. So it's very painless, but Dr. Thomas is a little bit of a baby. So we'll see how he does. We'll film that for you.
Yeah, but I mean, it is. I mean, patients can come in, they can get it done on their lunch break, and they technically could probably go back to work.
Mm-hmm.
We do ask that you do some, we want to minimize things coming into the procedure. So avoid ibuprofen or aspirin for 5 days prior. We try to avoid alcohol the night before. Try not to come in from straight exercising, mainly because all those things can increase chance of bleeding, risk of bruising. They vasodilate, which means swelling of the blood vessels. So we also tell some patients to take arnica, which is a supplement that you can take prior to the procedure and after the procedure, which helps with bruising and swelling. So there's a lot of things we can do to minimize your downtime.
The after effects. And, just revisiting too, mid-face isn't the only area we can treat, right?
Yes.
So we also do jawline filler, chin, temples,
lips
are the most common that you guys all probably know about. But sometimes people get nervous because they're afraid it's going to look unnatural and that people are going to look at them and say, oh, you've had something done.
Yeah, and it really depends on where you go. We have a big philosophy here is that we're not trying to make you look like someone else. It's basically we're trying to make you look like you did 5-7 years ago, right? And that's what gives the goal is that patients, or I mean, patients going out after fillers, people aren't saying, "Oh, what did you get done? You did something." It's more that, "Oh my God, you look so refreshed. You look like you got sleep. It looks like like what have you like? Were you on a spa day?
Yeah, did you get a facial? You look so good. What have you been doing?" But not looking at you saying, "Oh my gosh, you got filler."
Yeah.
We are always err on the side of caution, right?
Yeah,
so
less is more. We can always put more in, but we want to look at the patient and try to get that facial like balance. Some patients come in and they're really bothered by their nasolabial folds or their marionettes, and it's up to us to kind of determine like, we don't want to just band-aid this area with filler. We want to figure out why is that happening, right?
Yes.
And so oftentimes, like Rachel was touching base before, it's that mid-face volume loss. Like once you start to lose what's called a malar fat pad, which is that cheek fat it starts to deplete in volume and start to fall down. Well, that's going to create the nasolabial fold volume loss. It's also going to cause the marionettes. It's also going to cause some saggy jowls, right? So we want to start, and often if you're just focusing in one area, I kind of say that's when you can kind of look like Homer Simpson.
Yes,
You
exactly.
look unnatural, so it is super important to go somewhere that, one, you trust, but I pride ourselves on like making sure that we're giving patients the most natural outcome, and taking care of them from what their concerns are, but then also educating on them why they have to start somewhere.
Yes. And most people do need several fillers. So one syringe of filler is only a fifth of a teaspoon.
Yeah, one little tiny little
bit, but we use it well. So that's how we can stretch it. But a lot of people are nervous, like, oh, I really need 3 fillers, or I really need 4 fillers.
And so what we usually say is, like, for every decade of life is, so we say in your 30s, you're using anywhere between 3 to 4 fillers if you're going to look for complete restoration or volume. In your 40s, it's 4 to 5 syringes, 50s, 5 to 6 syringes. And again, 5 syringes sounds like a lot, but it's really 1 teaspoon. It's not a whole lot. And you're not just putting it in one area, remember? So when you do 5 syringes, we might be putting it in the temples, the cheeks, the nasolabial folds, the marionettes. We can now do jawline. We can do chin. And so these are all FDA on-label approved areas for fillers. And I guess we should touch base on what fillers do we use at our practice. Really, we use 2 of the major filler brands in the US, and that's Juvederm and that's Restylane, right? Juvederm fillers have been around. It first got FDA approval, and it's coming up on 20 years next year. So in 2006 was when they got their FDA approval. And so it's coming up on 20 years next year on when they've been in market. But indications for different areas as it's evolved, they've got new products that are specific for different areas of the face.
Yeah, and the great thing also about those filler lines and those companies is they provide advanced provider training. So if they get a new indication for a different area of the face, they will actually come in and have trainers come in to show us how to do it. If there's new techniques with injection, they will come out. Recently, we did a training, an advanced training. Amazing. We'll pull the before and after pictures up here, but you'll see we did 11 syringes on this patient.
Yes. And that's this patient. It was, she had done so. She looks amazing. First off,
she's done lasers before.
Done lasers. Yes. We had seen that she's lost some weight, so she was really bothered by certain areas, especially the nasolabial folds and the jowls. And we had to do correction of the mid face. We had to do correction of the nasolabial folds. We did jawline to help with her jowls. We did marionettes. We did chin. I mean, it is amazing. And she was back at work the next day. She had pretty much zero downtime, a little soreness, especially in the jaw area. But again, that goes away in about 3 to 5 days. But she's a new, confident.
Yeah, she's very confident. So and I mean, you're seeing the pictures. She doesn't look unnatural, right? She looks very natural. She's so happy with it. And so 11 syringes sounds like a lot, but as you see, it gives you very natural results.
Yeah. And my favorite part of that was we actually videoed her when she looked at the mirror for the first time after to see her after results, and her reaction was just priceless. You know? And again, it's, it sounds like a lot, and it is. I mean, again, 11 surgeries is a lot, but this patient, needed it in certain areas, and we wanted to get her correction. And you guys can be the judge of how we did. And remember, so like in Juvederm's line of fillers, there's about 7 different syringes, right? So it's for us to kind of decide which one we're using, and there's some that last 6 to 8 months, and there's some that last 16 to 18 months. But it's depending on the location that we inject it, where we're putting it, and the type of filler it is. Some are what we call more have a higher G prime, which is a more of a lift capacity. They're being injected deeper on bone. And some are more superficial for the lip lines around the mouth or the side lines when you smile. So we have to see you, we have to assess you. We're then going to be able to determine what's the best plan of action, best course. And we'll take care of you.
Yeah, absolutely. So give us a call, come on in for a consultation. And even if filler is not what you're looking for and you're looking for something else, we obviously have lots of different options. So come on in.
It's completely true.
Yeah.
Because it's combination therapy, right? Sometimes you have to start with lasers, or sometimes we're starting with microneedling, and then maybe we're going to do a filler afterwards. But we'll formulate a plan. We got you.
Yeah. See you soon.